And if you don't fight like hell, you're not going to have a country anymore.
Today, the state legislature voted in favor of changes to Tennessee's Medicaid program. Last week, the federal government approved a Medicaid block grant waiver amendment for Tennessee. It would be the first state to get Medicaid funding in a lump sum.
I think it needs to be stopped before harm is done.
Tina Claxton's daughter Abigail was born with a rare metabolic storage disease called Hurler syndrome. The 25-year-old is insured through TennCare. Her mom says it's critical to have that coverage.
It's her life. It is. It's her life. I mean, at this point in the ball game, without TennCare coverage, without us having the broad spectrum of medication that we're able to get for her right now, I mean, it's what's keeping her alive.
Critics like Congressman Jim Cooper will ask the incoming Biden administration to reverse the waiver. Here's why.
It's really a way for Tennessee state officials to shortchange Medicaid recipients. It offers the possibility of savings from an unspecified source, and that money saved could be spent for non-healthcare purposes.
We're proposing to blow up a system that is working, that can be improved, but it's working in the middle of a pandemic. Or we can improve our system, expand TennCare, and start realizing billions without reinventing the wheel. We could be receiving a 90-10 federal share to expand TennCare for past several years and could still do so moving forward. This stands in stark contrast to if we want to expand and cover more people moving forward under this, we'll be doing so at a 65-35 split. That math is not in our favor.
There's no authority to grant a block grant waiver, but that didn't deter our state from seeking a block grant out of enthusiasm for all things Trump. The one place that we know that it will happen is in pharmacy services, because they say they're going to establish a pharmacy program like a commercial insurance program. And commercial insurance programs are in business ultimately to make money for their investors, their commercial enterprises, and they avoid serving populations with the heavy care needs. They don't serve anybody who's over 65. They don't serve people with disabilities. That's what Medicaid is for. It's just very disappointing to hear someone like Governor Lee express concern about equity and raising the health of all Tennesseans and continue to refuse to even consider extending coverage to a population where all of the data shows that the refusal of that coverage is costing people's lives, and it's disproportionately costing lives in this pandemic of people of color. For 50 years, healthcare costs have gone up more rapidly than personal income, the growth of the economy, the growth of state revenues. And so the expectation of the people who have sought to basically cripple Medicaid with a cap on funding is that if we cap the funding, it'll gradually be cannibalized by healthcare inflation over